The agenda this week looked closely at the party platforms on health care and considered why debt and deficit haven't been top election issues. Here's some of what we heard. There are countries in Europe, of course, that have debt to GDP ratios at 100 or 150.
Well, try ours at about 89 if you add in the provinces and the federal government, which is higher than, I think, any of the other G7 countries, including Italy, which is 61 or 62.
Okay, so having said that, though, as we're looking at this and trying to decide, are we carrying too much debt? Is the debt level acceptable? Do we need to reduce the size of our debt and deficits? If we're at 30 federally and 40 in the province of Ontario, are those okay numbers?
They're okay today because interest rates are so low. There's nothing that says they won't go up. There's nothing that says there won't be a severe recession, which will reduce revenues. All those things have to be factored in. The risks don't change. They're the same as they were in the mid-90s when Paul Martin was dealing with this huge fiscal problem. They just haven't shown up yet. Doesn't mean they won't.
Andrew, put your political scientist hat on for a second. Take your economist hat off. And just talk to us about, I want to compare last year's Ontario election with the current federal election. There's been precious little talk about the significance of debts and deficits in this federal election campaign. Why such a big deal a year ago, and all of a sudden, a year later, it's just not a big deal at all?
Well, we've been discussing this. It's partly because the situation of the provinces is different than the situation of the feds. The feds ultimately, of course, have the printing press. That's not something I recommend, but sovereign debt of a national government is always slightly different than debts of provinces, and therefore they're treated differently in the credit ratings, for example. So it's a more difficult conundrum that Ontario is facing. It's also that the political alignment is different. The Liberals federally in 2015 broke the taboo on running deficits, and so it changed the alignment federally for that reason. As I say, there are more reasons to try to balance your budget than just because you're in a debt crisis. You can be prudent even without waiting for the crisis to arrive. And there's more reasons to want to control spending than just balancing the budget. Part of the problem, I think, in our politics is the right in particular got very used to just saying, well, we can't spend on that program just because we have a deficit. So when the deficit disappears, what's your argument against spending on that program? And so that's how you get, universal subsidies for camping trips. We just simply stop looking at things and saying, is this the wisest use of scarce dollars? Because everything ultimately is scarce. So I think we need to get back to looking at, since the crisis federally is not at our door, we need to get back at looking at saying, is this the best possible expenditure of that money? Could we spend it for a better use? Would it be better use given back to taxpayers in tax cuts? Have those kind of discussions than just, oh my goodness, there's either a crisis or if there's no crisis, then anything goes.
Can I get you on this issue of why in this election campaign debt and deficits are barely spoken about, whereas a year ago in the Ontario election campaign, it did come up a lot?
It did come up a lot, and I think part of the difference is just that in the Ontario election, there was a party that offered a more straight and quick pathway to a balanced budget, where federally we're not seeing that. And so the Conservatives provincially offered that or used that as a wedge issue, and federally the Conservatives are trying to distance themselves from the Ford government that did that. So they're making different issues the wedge issues, and it might not be so much that people care more or less about it than they used to, but that's what's on offer.
We've got Medicare because the federal government intervened and said, here's money, and here are some conditions, no user fees, universal access. So they can do that. They can buy change with money. And that's what the federal government can do with pharmacare. And we've seen the parties argue about how much money they would provide. But then you get lost in the nitty-gritty of what exactly do you mean by pharmacare. But, the NDP and the Greens have both made massive promises of spending. Now, Steve, very well that the less chance a party has of getting into power, the more grandiose their promises. The Liberals and the Conservatives, who are fighting to win, have made very modest promises. The Liberals said $6 billion to kickstart over 4 years, but that also includes other things. And the Conservatives have essentially said it's a provincial responsibility. So I think if you look at all the promises, there's been a lot of talk, but I don't think anything will really change, sadly.
Do you think, Brett, that there are pitfalls associated with bringing in a national pharmacare program?
I think there's a lot of pitfalls. First of all, I think what we're looking at is a program that is addressing maybe not the most pressing issue that we face in Canada today in healthcare. So if you look at access to prescription medications. And if you look at the amount of people that are struggling with access in Canada, typically this ranges, depending on the study that you look at, from about 10 to 25% of the population. So right now, in some provinces, we have very good programs that help those populations. In other provinces, maybe not as good. But when we look at what is the solution, I believe that the solution is not to over-legislate. It's not to provide pharmaceutical coverage for everybody, even those who are well covered right now, who have no difficulty accessing. I think we have to really focus on providing care for those people that actually are struggling with access right now.
That's the Conservative platform.
Yeah, let's not tear apart the part of the system that actually works. The other part of the issue that I'd like to talk about is what we've seen in other countries where pharmacare has been implemented. So I do believe universal pharmacare in one form or another is a good idea, but it has to be done correctly. So if we look at, for instance, some of the examples in other countries where the amount of prescription medications that are available has gone down drastically, where physicians regularly say they are not able to prescribe the medications they prefer to prescribe any longer because they're no longer covered by the government, where private insurance is no longer available as an option. So for those who require an expensive medication that the government doesn't cover, they have no option to get that medication. So there are a lot of pitfalls that we have to be very cautious about. The whole other side of the question is, where's the money going to come from? We're barely able to fund our existing system of physician care. I can tell you, I can see the cracks in the seams of healthcare just in my hospital where I work, where we can barely treat the patients that are coming in the door as it is. I've seen the estimates for pharmacare ranging as high as $15 billion a year. Where is that money going to come from?
I think it's quite important
Quinn,
just to remember, I do think that it's true to say that anything done badly is bad. Right, and the most likely thing is that a bunch of professionals getting together to do things will do it well. And you'd look at places like the UK where there's a pharmacare strategy which is better. You could even look at New Zealand where they're paying less for each drug than we do here in Canada. One of the reasons for a national pharmacare strategy is because we waste huge amounts of money on expensive drugs that don't need to be that expensive. So I think it's important to do it. But I think we need to be able to, for me, I'm interested also to think of what that means, and specifically what that means for mental health. A lot of common mental disorders are treated better by psychotherapy than drugs. And if you start going down the line of thinking, we're going to do a national pharmacare strategy, is this another sort of stigmatization of mental health? You get drugs, we don't get the therapy. Would there or should there be a national psychotherapy strategy if there's going to be a national pharmacare strategy?
And that's just a peek at what we covered this week on the agenda. For more, including the full conversations, you can visit our website. That's tvo.org. Our YouTube channel at youtube.com/theagenda, or our Twitter feed. That's twitter.com/theagenda.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.